September 30th, 1811, in Paris, a novelist named Fanny Burney is lying on a mattress in her own bedroom. 4 carriages have just pulled up outside her house. 7 men, all dressed in black, walk into her room. There is no medicine that can put her to sleep. No injection, no mask, no gas. Just a folded handkerchief laid over her eyes so she won't have to watch what happens next. Through the cloth, she catches one last glimpse of something. The glitter of polished steel. She closes her eyes. Then a voice asks, in French, "Who will hold this breast for me?" And the operation begins. Burney survived, but it took her 9 months to find the courage to write down what happened. And when she finally finished the letter to her sister, she sealed it and sent it without even reading it back, because, in her words, the memory was still too painful. Here's the thing. If you need surgery today, someone puts a mask over your face, you count backward from 10, and the next thing you know, you're waking up pain-free with zero memory of anything in between. That gap, the blank space between falling asleep and waking up, might be one of the greatest gifts modern medicine has ever given us. For almost all of human history, that gap did not exist. So what did surgery actually feel like before anesthesia? Not the textbook version, the real, wide-awake, screaming truth of it. Stick around, because by the end of this video, you'll understand exactly why people once said going under the knife was a fate worse than the disease that put you there. To understand how bad it really was, you have to picture the room itself. Before the 1840s, an operating theater wasn't hidden away behind sealed doors. It was often, literally, a theater. A small, steep amphitheater with wooden benches rising in a circle around a central table, packed with medical students craning forward to watch. Surgery was entertainment. Education and spectacle rolled into one. There was no sterilization because germ theory didn't exist yet. Surgeons wore their normal clothes, sometimes the same blood-stiffened coat for years, worn almost like a badge of experience. The same knife might be used on multiple patients in a row, wiped at best on an apron. The patient would be carried in and laid on a wooden table, sometimes still stained from the last operation. And then came the part that made surgery genuinely feel like an act of violence, the restraint. Because there was no way to keep a person still through sheer willpower once the cutting started, hospitals used teams of strong young men, often medical students, called dressers. Their job was simple: pin the arms, pin the legs, hold the head so it couldn't thrash. A rolled handkerchief or leather strap was sometimes pushed between the patient's teeth, not to stop them from biting their tongue, but to muffle the screaming for the sake of everyone else in the room. Think about that for a second. Before you were even cut, the plan was already, this person is going to scream, and we need to be ready for it. That was the baseline. That was surgery on a good day with a competent surgeon and no complications. Just try to imagine what it looked like when something went wrong. Now, it's not that doctors weren't trying. People have been searching for a way to dull surgical pain for thousands of years. The problem is that almost nothing they came up with actually worked well enough to matter. Go back to the Middle Ages, and you'll find surgeons using something called a soporific sponge, a rag soaked in a mixture of opium, mandrake root, and hemlock, held under a patient's nose to try to knock them out before the cutting began. The issue was dosage. Too little, and the patient felt everything anyway. Too much, and you'd killed them before the surgeon even picked up the knife. Hemlock, remember, is the same poison that killed Socrates. By the 1600s and 1700s, the go-to option had simplified into laudanum, opium dissolved in alcohol, or just straight-up hard liquor, given until the patient was as drunk as possible. It didn't remove the pain. It just made people slightly less able to fight back against it. Then there was mesmerism. In the late 1700s, an Austrian physician named Franz Anton Mesmer developed a theory that the human body contained an invisible magnetic fluid, and that by manipulating it, through what basically amounted to hypnosis, he could put patients into trances deep enough to operate on them. It sounds like nonsense, and most of the medical establishment treated it that way. But bizarrely, some surgeons genuinely reported operating on mesmerized patients who barely reacted. In 1843, a British doctor named John Elliotson even published a whole book of case studies titled, and I'm not joking, Numerous Cases of Surgical Operations Without Pain in the Mesmeric State. And then there's my personal favorite, because it's the most We're just guessing at this point, method of all. Nerve compression. In 1784, a surgeon named John Hunter tied a tourniquet so tightly around a patient's limb that it cut off enough sensation to numb it before amputation. It actually worked. Sometimes. Other doctors tried pressing directly on the arteries in the neck to choke off blood to the brain just long enough to make a patient pass out, which, if you did it wrong, would just kill them instead. So that was the menu. Get someone drunk, drug them with a poison-adjacent sponge, hypnotize them, or literally strangle part of their body until it went numb. None of it was reliable. Most of it barely worked at all, which meant that for the vast, vast majority of operations, patients were simply awake. Quick pause. If you're finding this as unsettling as I am, hit subscribe, because this is exactly the kind of buried history this channel digs into every week. Okay, back to the operating table. If chemistry couldn't save you from the pain, there was really only one variable left that mattered: time. The faster the surgeon, the less time you spent in agony, the less blood you lost, and the better your odds of surviving the shock afterward. Speed wasn't just a nice bonus. Speed was the anesthesia. And no one embodied that better than a Scottish surgeon named Robert Liston. By the 1830s, Liston had a reputation as the fastest knife in London. Some called him the fastest knife in the West End. He could amputate a leg above the knee in under 30 seconds, start to finish. Before every operation, he'd stride into the packed amphitheater, knife in hand, and call out to the students in the gallery, "Time me, gentlemen, time me!" Then he'd cut through skin and muscle so fast that witnesses said the flash of his blade and the sound of the saw hitting bone seemed to happen at the exact same instant. And here's the wild part. It worked. While the average surgeon of the era lost about 1 in 4 amputation patients to shock, blood loss, or infection, Liston's death rate was closer to 1 in 10. His obsession with speed was genuinely saving lives, because for a patient with no anesthesia, every extra second on that table was a second closer to their body simply shutting down from the trauma. But speed that fast comes with a cost, and Liston's most infamous operation is proof of exactly how thin that margin was. This particular story has been told and retold for over a century, so treat it as the legend it's become rather than a courtroom transcript. But as the story goes, Liston was mid-amputation, moving at his usual breakneck pace, when in the frenzy of his own speed, he accidentally sliced off 2 of his assistant's fingers. In the same swing, his knife caught the coat of a spectator standing too close to the table. The man, convinced he'd just been stabbed, dropped dead from shock on the spot. The patient and the assistant both later died from infections in their wounds. Which means that one single operation, by some accounts, carried a mortality rate of 300%. One patient, 3 deaths. That single, chaotic story tells you almost everything you need to know about surgery in this era. When your only anesthetic is speed, you are always one bad angle, one flinch, one moment of adrenaline-fueled overconfidence away from disaster. And people accepted that risk gladly, because the alternative, a slow surgeon, was somehow considered worse. But let's go back to where we started, because I want you to really sit with what this felt like from the patient's side. Not the surgeon's story, the patient's. Fanny Burney was one of the most successful English novelists of her generation, a best-selling author decades before Jane Austen. In 1810, at 58 years old and living in Paris, she started feeling a persistent pain in her right breast. Over months, it got worse. Doctors examined her, argued among themselves, and eventually agreed it had to come out. A mastectomy, full removal of the breast, without a single drop of anything to numb the pain. She was given almost no warning, just 2 hours' notice on the morning of the operation. The surgeon in charge was a man named Dominique Jean Larrey. Hold on to that name, because we're going to meet him again in a very different setting in just a few minutes. On the day itself, 7 men entered her bedroom. A physician gave her a small glass of wine cordial, essentially the extent of her pain relief. 2 old mattresses and a sheet were laid out. She climbed onto the makeshift table herself. A cambric handkerchief was placed over her eyes, but before it blocked her vision completely, she caught sight of the surgical instruments laid out and waiting. The glitter of polished steel, as she later put it. She closed her eyes and didn't open them again until it was over. Then she heard Larry ask who would hold her breast steady for the incision. The knife went in. By her own account, she began screaming and did not stop for the entire duration of the cut. She wrote to her sister afterward that the sound of her own scream in that moment still seemed to ring in her ears. The pain was bad enough that she blacked out twice during the procedure. Total blank spaces in her memory that she could never piece back together, no matter how hard she tried. She survived. The tumor never came back, and she lived another 29 years. But it took her 9 full months before she could even attempt to put the experience into words for her sister. And when she finally finished that letter, one of the most detailed surgical accounts that survives from this entire era, she sealed it and mailed it without rereading a single line, because reliving it even once more on paper was more than she could bear. Sit with that for a second. A world-famous author, financially comfortable, getting the best medical care 1811 France had to offer, and that was still the experience. Stories like Bernie's weren't rare exceptions, they were the standard, and the psychological toll of that standard shaped how people lived. Patients would delay surgery for years, sometimes until a treatable tumor became fatal, purely because the operation itself was more terrifying than the disease. Surgeons carried the weight of it too. Operating on fully conscious, screaming patients day after day is not something the human mind processes for free. Which brings us back to that name I asked you to remember, Dominique Jean Larrey. The same surgeon who operated on Fanny Burney in her bedroom in 1811 was at that exact point in his career also the chief surgeon of Napoleon Bonaparte's entire army. A year after Burney's mastectomy, in September of 1812, Larrey found himself at the Battle of Borodino, one of the single bloodiest days of the entire Napoleonic Wars, with tens of thousands of casualties in a matter of hours. Larrey reportedly performed around 200 amputations in 24 hours. Do the math on that, and it works out to roughly 1 full amputation. Cutting, sawing, tying off blood vessels, closing the wound, every 7 minutes, non-stop, for an entire day. No anesthesia for any of them, just his hands, a blade, a saw, and soldiers screaming until, mercifully, they passed out from the pain and blood loss. Larrey is also the reason we have the modern concept of triage, treating the most critical patients first, regardless of their rank, and the idea of the flying ambulance, fast-moving units that pulled wounded soldiers off the battlefield within minutes instead of leaving them to die where they fell. In other words, one of the most humane, forward-thinking doctors of his era was also, by necessity, one of the most brutal, because brutal efficiency was the only mercy available to him. That's really the core tragedy of this whole period in medical history. The good doctors, the compassionate ones, the innovators, they weren't struggling against a lack of skill or a lack of care. They were struggling against a hole in human knowledge that simply hadn't been filled yet. All the surgical genius in the world couldn't invent a molecule that didn't exist yet. That hole finally got filled on October 16, 1846, in a domed operating theater at Massachusetts General Hospital that's still standing today. It's now nicknamed the Ether Dome. A Boston dentist named William Morton had been experimenting privately with a chemical called sulfuric ether, and he convinced a respected surgeon, Dr. John Collins Warren, to let him test it publicly. The stakes were high. Just 1 year earlier, in that exact same room, a different dentist had tried, and very publicly failed, to demonstrate a similar idea using nitrous oxide. His patient groaned in pain mid-procedure, and the crowd of doctors mocked the whole idea as a fraud, a humbug. So when Morton walked into that amphitheater with a glass inhaler full of ether-soaked sponge, the room was full of skeptics. His patient that day was a young Boston printer named Edward Gilbert Abbott, who had a tumor on the side of his neck. Morton had Abbott breathe in the ether vapor until he went still and unresponsive. Then Dr. Warren picked up his scalpel and made a 3-inch incision into Abbott's neck. And Abbott didn't move, didn't scream, didn't flinch. When he regained consciousness a few minutes later, the surgeons asked him what he'd felt. He said it was something like being scraped with a blunt instrument. No real pain at all. Dr. Warren turned to the stunned crowd of physicians in the gallery, men who, 1 year earlier, had laughed a similar idea out of the room and said the 4 words that basically launched modern surgery. "Gentlemen, this is no humbug." News of what happened in that room spread across the Atlantic Ocean within weeks, genuinely remarkable for 1846. And here's where the story loops all the way back to where we started. Just over 2 months later, on December 21st, 1846, a surgeon in London performed the very first operation under ether anesthesia anywhere in Europe. That surgeon was Robert Liston, the same man who built his entire reputation, his entire legend, on cutting faster than pain could register. The fastest knife in the West End picked up a glass inhaler instead of relying purely on his own speed, watched his patient lie completely still and silent through the operation, and turned to the crowd with his own verdict on what he'd just witnessed. This Yankee dodge beats mesmerism hollow. The man whose entire career had been built around outrunning agony had just watched agony get switched off completely. And he knew, probably before almost anyone else in that room, exactly what that meant for the future of his profession. Within a few short years of that day in the Ether Dome, restraint teams, biting straps, and "time me, gentlemen" became relics of a medical dark age that most people alive today can barely even picture. We complain about hospital wait times and paperwork. We rarely stop to think about the fact that we will be fully, chemically unconscious for the actual cutting, that we get to skip the worst part of surgery entirely, every single time, without even having to ask for it. That gap between falling asleep and waking up isn't just a medical convenience. It's arguably one of the most significant, most underappreciated gifts an entire species has ever given to itself. For pretty much all of human history, up until less than 200 years ago, that gap simply did not exist. If you needed surgery, you were there for every second of it. So the next time you're sitting in a waiting room, mildly annoyed about a delayed appointment, or nervous about an upcoming procedure, it might be worth remembering Fanny Burney, wide awake with a scalpel scraping her breastbone, or Robert Liston, knife between his teeth, racing the clock because the clock was the only thing standing between his patient and pure agony. We are, genuinely, the first few generations in the entire history of our species who get to sleep through it. If this kind of story, the hidden, uncomfortable history behind the things we take for granted, is the kind of thing you find yourself thinking about, that's basically the entire point of this channel. Subscribe if you want more of it, and let me know in the comments, knowing everything you just heard, would you have had the courage to go through with an operation like Bernie's, or would you have just lived with the pain? I'll see you in the next one.